So hello guys and welcome back on my channel. Today I thought I would just want to talk about tokophobia because I think it's important to talk about topics like these. So it's definitely a sensitive topic that affects some child-free women. So when you're talking about tokophobia, you're talking about the fear of pregnancy and birth. And I think some of the people who do not want kids have tokophobia, so they have a fear of pregnancy and childbirth. Pregnancy and childbirth are major events in many women's lives. While it can be a great joy, it can also be a source of stress and anxiety. Women often worry about the normal pain of childbirth and about the possibility of something going wrong. These are all normal concerns that almost all pregnant women experience to some degree. The normal anxieties that accompany bringing a child into the world are often dealt with using medical help, education, social support, and self-help strategies. Sometimes, however, this fear can be pathological and so severe that women will avoid becoming pregnant or giving birth altogether. Symptoms of tokophobia. Tokophobia is a type of specific phobia which is an anxiety disorder in which people feel an irrational and unreasonable amount of fear about a specific object or situation. This fear tends to center on concerns over labor and delivery, medical treatments, decision-making, finances, and parental capabilities. Symptoms of tokophobia can include sleep disturbances, panic attacks, nightmares, and avoidant behaviors. Men can also experience tokophobia. Researchers have found that men with tokophobia often have a severe fear regarding the health and safety of their partner and child. Causes of tokophobia. Researchers have suggested a number of explanations to account for the development of tokophobia. Some of these including hearing about traumatizing accounts of childbirth experiences from other women, fear of inadequate pain management, and pre-existing psychiatric conditions such as anxiety and depression. And there are two different types of tokophobia. Primary tokophobia occurs in women who had never experienced birth and may begin during adolescence, although it can also occur after a woman has become pregnant. It may also be seen in girls and women who have been assaulted already. Medical exams during pregnancy and childbirth may also trigger flashbacks of the original trauma. Secondary tokophobia occurs in women who have previously experienced pregnancy and birth. It is often the result of traumatic labor and birth. However, it can also occur in women who had normal, non-traumatic birth, as well as women who have experienced miscarriages, stillbirths, pregnancy termination, or failed fertility treatments. So this is just shortly what tokophobia is about, and I think it's really important that we talk about these kind of topics because me personally, I do not think this is a weird or unreasonable fear, simply because there's a lot of things that go wrong while you're pregnant, and there's a lot of things go wrong in pregnancy. Just like compare, it's a lot safer to get an abortion than it is to go full term with your pregnancy. So there is a lot of risks in getting pregnant. So personally, I do not think this fear is unreasonable, but it can of course get to an unreasonable stage where you might not even be able to look at pregnant women or anything regarding birth makes you have this fear. And if anything regarding birth and kids and pregnancy, if that instills your fear, I think then it becomes a problem and then it's something you have to talk with a professional about. But just being afraid of birth and pregnancy, like that's totally reasonable, but when it becomes a fear, we need to get help with combating it because it can easily take control, and when it takes control it can go really bad because it's hard to exist in this world and be afraid of anything that regards pregnancy and birth because there is like things about pregnancy and birth all around us. It's not very often that we go through our entire life and not see anything regarding pregnancy and birth. So if you get a panic attack or just a severe reaction, just being in contact with something that has to do with pregnancy and birth, then you really have to get help, because then it has become unreasonable. But just having a fear of birth and pregnancy, that's totally valid. But when it comes a fear that takes over you and where you can't have anything to do with pregnancy and birth, then you really need to get help. So it's good to know what tokophobia is, and it's also good to know if it takes over your life, if it's starting to do that and become a fear you can't control, then it's really important that you also seek help. So that's what I'm trying to say with this video. But I hope you could use some of this information. Maybe you or someone you know is suffering from tokophobia. And it's just really important that we are reflective and we notice if our fear is taking over our life and if it's beginning to be unreasonable. Because if it's beginning to be unreasonable, we have to do something about it. But yeah, guys, I hope you enjoyed this short video. And if you like me and you like my content, please remember to comment down below and subscribe and like and all that good stuff. And I'm sorry about the lighting if it was bad today, because it is November, and I'm getting the last sun of the day, because it'll begin to get dark soon. I don't have a ring light or anything fancy, so I'm depending on a natural light. I do not hope that bothered you too much. I do not hope you were too annoyed with my pets' noises. But yeah, guys, I just hope you enjoyed this video, and I hope I will see you soon in another video. And I'm just going to say bye, guys.